Greetings from Bilmed Group of institutions. Myself, Dr. Abhiwani. We will be today taking very interesting topics, level 1 scamming. With me is Dr. Mujin Goel.
Hello.
She is MD Gynae, Associate Professor, and she is faculty of Bilmed also. So, the topic, level 1. In level 1, the basic important point what you have to understand is the section. What section has to be, from the fetal side, so that to take a level 1 scan. If you are not understanding the section, you will always and always struggle with this NT. If you understand this section, then the level 1 is a kid's job. Otherwise, you will struggle for decades together to get the nasal bone, ductus venosus, and all these things, what is to be needed in the level 1. So, Dr. Gunjan will start with the scanning techniques. I mean the section, what the section should be from the fetal side.
Hello, sir. Hello, viewers. Today I'll start with the anti-scanning. What section should be taken and how it should be taken? What should be the scanning technique? See, actually, it's a sagittal section, and it should be the head and thorax should be in the view, and it should be taken with proper view of just head and thorax only.
So the basic important point is that the fetal section has to be complete mid-sagittal section. The fetus has to be in length. If you are having a complete mid-sagittal section, pay attention over here. If you are cutting, your beam is cutting a mid-sagittal section from this fetus, what is there on screen? The image will be like this over here. And not always it will be a static image because fetus is moving here and there. You have to be very patient. So anyhow, this is the complete mid-sagittal section which you have to look for when you are taking the level 1 scan. So this is that section where you are also taking the crown rump length. Now, the point here is that what to see for. First of all, the Nuchal Translucency is the one. Second, you have to see for ductus venosus, DV. Third one is the ICT, intracranial translucency, and sometimes we have to see for the tricuspid regurgitations. But if you will be able to see for nasal bone, Nuchal translucency, and ductus venosus, that much is sufficient for you to have this, a good NT scan. Now, pay attention over here. Sometimes I am having an amnion also in the section, amnion. Now see, this is the amnion over here. This amnion is looking like over here that I am taking I am having a NT, which is, when you will measure this will come, of course, abnormal. Now, how to differentiate whether this is an NT or NB? Amnion or an NT?
See, basically, when the patient moves and we have to change the view of the appearance, then when the patient moves and you can easily, when the baby moves, obviously you can differentiate that this is an amnion and this is separate from the nuchal translucency.
So the point here is that when fetus will move, it will take NT along because NT is the part of the fetus. But this amnion is not a part of the fetus. So this way, sometimes you may get fooled. So here, wait for fetal movements to see whether I am dealing with a true NT or an amnion. Now, ICT, intracranial translucency. What actually this intracranial translucency is? You start.
Actually, intracranial translucency is basically
the fourth ventricle.
It's basically the fourth ventricle. We try to see the fourth ventricle, and there are some supporting structures also there which we have to see.
Now, the basic important point is that this ICT is nothing but a fourth ventricle. Now, why this is important? Because in spina bifida, I will not be able to see an intracranial translucency. This ICT, this fourth ventricle, will be obliterated. So this is the point why we are seeing this intracranial translucency. We will take it in detail. So first, we are giving a small teaser over here. So this is the ICT. This is the intracranial translucency over here. The section again, the mid-sagittal section. I told you that the complete mid-sagittal section is the backbone. Without complete mid-sagittal section, you will neither see a nasal bone, nor the NT, nor this ICT. So intracranial translucency will be seen just over here when you see the, cisterna magna. We will discuss this in detail. So let's start with the, this knuckle translucency. Now, this knuckle translucency, what actually this is a term which is be used to see for the fluid collection under the skin. What gestational age? 11 to 13.6. So it is from 11 to 14 weeks. So specific 13.6, 13 weeks and 6 days of pregnancy. Now, knuckle translucency, sonographically, we are seeing it, subcutaneous accumulation of fluid behind the fetal neck in first trimester. Now, the point is, why not after 14 weeks? Because after 14 weeks, the incidence of abnormal accumulation of fluid in a chromosomal abnormal fetus. Now try to understand, in a chromosomal abnormal fetus is lower at 14 to 18 weeks than before 14 weeks. That is one. Second point is that the success rate, the point here is that success rate for taking this measurement is more between 10 to 13 weeks. It is about a 98 to 100%, and it is falling up to 90% after 14 weeks because the fetus becomes more vertical. More the vertical fetus, more the challenging for you to take the knuckle translucency. The fetus is more, horizontal before 14 weeks than after 14 weeks. That is why it is to be taken up to 14 weeks only. Now, how to take? You have to first magnify the image. Now see, over here, this fetus is in length. This fetus is in length. This is not a good section. Not section actually, the image for NT scan. You have to magnify over here to get this type of image. Magnifying where you have to magnify as large as possible, such as a slight movement of the calipers produce only a 0.1 millimeter change in the measurement. Now the point here is that if I will have a fumble over here to take this NT, a slight fumble will result in a dramatical change in your NT. And if you magnify this part only, the error will be less over here. So that is why the magnification is to be taken so that you are seeing the fetal head and the upper thorax only. You don't need over here the lower thorax. So that is why
mid-sagittal.
In mid-sagittal only, yes. In mid-sagittal, you have to now magnifying head with the upper thorax. Okay. Now, these types of structures you will be seeing over here when magnified. First of all, the nasal bone. The nasal bone is over here. Try to understand. This is the nasal bone over here. Not this. This is the nasal tip. So don't include the nasal tip. You have to take the nasal bone measurement from here to here. So this is the nasal bone over here. And we are saying that we are having a equal sign over here. Equal sign means that the nasal skin is over here. So this will give me an appearance of a equal sign over here. So first point is that nasal bone, it is over here. So don't take this nasal tip in account, only the nasal bone, and be aware of that I am having a nasal skin over here. Then what is this over here?
Hard palate.
Yes. So this is the palate over here. Then if this is the palate, now let's go to the brain over here. What actually I am seeing over here is the thalami, midbrain, brain stem, and this is the fourth ventricle, and this is ICT, which we will discuss in detail. And this is the medulla oblongata over here. So these structures you will be seeing when you are magnifying an image, which we discussed. Now, what has to be a CRN? CRN, when you are taking a Nuchal translucency, of course, 11 to 14 weeks, precisely 13.6 weeks, you have to take, and the CRL will be 45 to 85 millimeters. So it is to be performed when the CRL is in between this bracket. Now, if I am having an increased Nuchal translucency, what I can have is the trisomy 21. In trisomy 21, I will be having an absent NT also. With this increased NT, I will be having an absent NT.
Nasal bone.
Nasal bone, NB, nasal bone, and I will be having an AVSD also. So if you are having an increased NT with AVSD and an absent NT, you may be dealing with a trisomy 21. And in trisomy 18, if you are having an omphalocele over here, omphalocele, then you may be dealing with a trisomy 18. And if there is a holoprosencephaly features plus the omphalocele at the base of the increased NT, you may be dealing with the trisomy 13. So this way you have to think. If you are having an increased NT. Now, let's conclude this NT. This is the video over here, which will show you each and everything in detail. Over here, the section is mid-sagittal section, and it is to be taken in between 11 to 14 weeks, 13.6 weeks, when the fetus is structurally completely formed. And where to see, you have to see over here. So where you have to see under the skin behind the neck at 11 to 13.6 weeks of pregnancy. And that was a diagram of a 2D ultrasound, which we will show you. So here is the Nuchal translucency over here. So this is the NT over here, Nuchal translucency, a graphical representation of this, what you will see on screen. So this is the NT over here. This first is the NT Nuchal translucency over here. How to measure? Wire from to wire measure? We'll come to that. But pay attention to the fetal face over here. If you are cutting, your slice is cutting completely mid-sagittal section, and you are seeing this over here, take a guess what that is. What that is? That is nothing but the palate over here. You are seeing palate without zygoma. Very important. You are seeing palate without zygoma. Nasal tip is over here. This is the nasal tip. First is the nasal tip, then the nasal bone, and you are in the correct plane. Now the criteria for the measurement of NT. Criteria is that the crown rump length. Sometimes you are having a late conception, you don't know how big the fetus is. Your CRL has to be corresponding. We have discussed that CRL. Then the neutral position of the head. When I say neutral position, this chin should not be touching the neck, touching the chest, or it should not be in a extended position. And the gain, the overall gain of the image should be towards the not towards the lighter side, but towards the darker side. And where to measure? You have to see for the widest part. and your caliper has to be on to the line. It should not be inside or outside. It should be placed on the lines of this. And here we are showing you how the calipers has to be put. So these are the criteria when you are taking this NT in your patients. Now, if you are using THI, that is the tissue harmonics, these calipers should not be on the line but slightly inside, because you are using THI, that is tissue harmonics. So now get back over here. This is the nasal bone. This is nasal bone, and this is the frontal process of the maxilla. This is the frontal process of the maxilla. Try to understand, if your beam is not cutting centrally, but if it is cutting slightly obliquely, that will be a wrong plane. What you will see over here, if it is in the center, only palate. But if it is cutting through the frontal process, you will see this zygoma over here. So if you see a hockey-like structure over here, you are in the wrong plane. Then whatever NT over there may not be a accurate NT. So see, for over here, your palate should be like a palate only, a straight line, not like a hockey. Otherwise, you are in a wrong plane. See, this is wrong over here because you are seeing a zygoma over here, and this is the right plane to take the NT. So whatever NT I will be taking over here is right, and over there was not an accurate picture. Now you have to sometimes wait for the fetal movements to distinguish between the amnion, which we discussed. Now see over here, the normal NT over here, and this is the increased NT in case of this fetus which was a Down syndrome. So pay attention to the increased NT onto my right side in comparison. So visually I can also make out that this is a normal and that is an abnormal NT. Now, next is the ICT. ICT, that is the intracranial translucency. When I say intracranial translucency, I have to understand the structures inside the brain. So first I am having the midline structures of the brain. Midline structures of brain, they are here. Then I am having mesencephalon, cerebellum, fourth ventricle, cisterna magna, and occipital bone. See where my mesencephalon is over here. Now cerebellum, this is the cerebellum over here. This is the cerebellum. Now fourth ventricle, this is the fourth ventricle over here. This is the ICT. And what is over here? This is the cisterna magna. So can I say that the cisterna magna is posterior to fourth ventricle? I will not be wrong. So I will be seeing cisterna magna over here, and I will be seeing a fourth ventricle over here, and here I am having the occipital bone. Now, try to understand what wire is, because eyes can see only when mind is knowing. If your mind is not knowing, then you will not make out what wire is. Now, I will play this beautiful, very interesting clip of this ICT for you. Now, we have discussed about the brain structures which are easily seen over here, because your brain is not knowing that. That is why your eyes are not seeing these structures. Now, if I am having a midline structure over here, mesencephalon over here, cerebellum here, which we have discussed just now, fourth ventricle over here, and the cisterna magna over here in normal cases. But what will happen? If this midline structure of the brain will get displaced? What will happen? Try to understand. If this midline structure of the brain will get displaced, it will move down and it will obliterate the fourth ventricle. Now, a leaking in case of the spina bifida will lead to obliteration of fourth ventricle over here. You will not see this fourth ventricle because I am having a spina bifida. So this is the effect actually of the spina bifida. So you are not actually seeing a spina bifida in a small fetus. You are seeing the effect of the spina bifida in brain. Now, this is the spina bifida. Over here, I am not seeing an ICT, and I was seeing ICT in case of a normal brain. So ICT is telling me that I don't have any spina bifida. That is why we are including this in, this Nuchal in this first level 1. Now, third is the ductus venosus. Now, try to understand this ductus venosus. Ductus venosus is a very, very small vessel which is not seen on grayscale ultrasound.